I see, yes, that people currently now kind of, spurring me on to try to do new things, but I'm taking it myself. But in the past, one of those kind of regrets was that my wife and my parents, especially my wife, kind of championed for me to step into a possible new open position where I was before. And I did, again, not feel adequate. But looking back, yes, to regrets, because I probably could have done that or learned, as they can have leadership skills that can be provided to you or so.
Hello, everyone, and welcome back to another episode of the PTA Plus Podcast. I'm Katie Sutton, your host. Have you ever wondered if it's too late for you to go back and advance your skills as a PTA? I mean, some of us have been doing this for a while. Well, I'm here to tell you that it is not too late. And my guest, John Cooper, is also here to tell you that it's not too late. So today we talk about advancing your skills as a PTA, even if it's been a few years since you've been out in the field. We also talk about one of John's passions, which is limb loss awareness, and how PTAs can get involved in making sure that we recognize and bring awareness to this very important population of humans that we treat on a regular basis. So I hope that you enjoy today's episode, and as always, thank you for listening. Hello, everyone, and welcome back to another episode of the PTA Plus Podcast. I'm Katie Sutton, your host. We have our guest with us today, John Cooper, physical therapist assistant and APTA magazine rock star extraordinaire. So this is really exciting. I'm happy that you said yes to coming on to today's podcast. I'm always really impressed with people who say that they'll come on and talk to me when, I'm really kind of like a novice at this. And people have a lot of trust in me. So I do appreciate it. And
Yes, it's
welcome
awesome.
to the show.
Well, thank you.
So it's interesting. I read your article, of course, and then you and I got connected through social media, I believe. Sometimes I kind of lose track of who I talk to on which platform I talk to them on. I do a lot of connections through Instagram, a lot of connections through LinkedIn. I am not paid by either one of them to say that, but it does open up a lot of opportunities when you can find people, especially in your working areas, that you can kind of connect with and whatnot. So I would say 3 of the 5 guests that I have interviewed today were all connections through some kind of social media. And you are the second person that I had the chance to interview from APTA magazine.
Oh, that's awesome.
So yeah, so I mean, this is the value of networking and connection. And I just think I needed to say that because the more that we reach out and connect with each other, it just opens up doors and opportunities and friendships. And now the next time you and I see each other in person, we'll know who each other are.
Yes, definitely.
Yeah. So I thank you for coming on to share your experiences with specifically limb loss. We're going to talk a good bit about that today. I do hope that you can kind of give us a little bit of an explanation of what it's like to submit something to APTA and get it published in their magazine. I think that's pretty cool that you were able to do that.
Oh, yes,
Um,
definitely.
yeah, yeah. So, John, I'm going to stop talking because if I don't, I could just keep going. So I'll let you steal the show for a little bit. So why don't you tell the audience about yourself, who you are, where you're from, what do you do, all that good stuff.
Yes. Well, hi, thank you, Katie, for having me on your podcast. I'm excited to be on here and talk with you, and especially because this is my first time being on a podcast, and with one of maybe 5 times of being on a scenario like this with a call. But yes, I'm a practicing physical therapist for the past 17 years, with first 14 years being an experience in Valley, Alabama, with a rural hospital that had outpatients, inpatient, and nursing home all connected in the same facility. And as I chose to take it with the unique opportunity to float back and forth into those settings, if my primarily outpatient clinic allowed it with the schedules opened up or so, and now currently working closer to home in Columbus, Georgia, with HPRC, which is a partner brand of Confluent Health, which HPRC is celebrating their 70th anniversary, and they are the second oldest private physical therapy company in the country. And ironically, where I worked before was with HPRC contractor for about 5 years. In the hospital, did not keep that, but I continue to work there. And now working with HPRC for the past 2.5 years, feels like being back with family. Is some of the people I know working with before are still there, and just in the Columbus community that I know some of the friends as well. But yes, and since listening to your podcast, PTA podcast, and your guests, you have inspired me to follow and find my own plus points, is especially with pursuing the newly developed passion for treating the lower limb loss extremity population with their prosthetics. And that lead me into, of course, to having the article. Is I find your podcast to be very inviting to step outside of your comfort zone and not be so stagnant of maybe just the blinders that can be on with treating, and stepping outside to be of other things. But yes, so thank you.
Yeah. Well, I'm glad that it's inspired at least one person. So, I mean, that was the whole premise behind the podcast, was to give PTAs a voice, and to empower PTAs to be okay with making moves and taking chances and asking questions and showing up and stepping up to the plate, all of those things. And just really highlighting all the things that we do aside from our work in the clinic or with our work in the clinic, because as we're going to get into, not all clinic work looks the same, right? So
Exactly.
some are much more niche practices, some are very open. You might see a little bit of everything. So it's important that we focus on all of those different pieces and parts that make us a physical therapist assistant.
Mm. Oh yes,
Yeah,
definitely.
yeah.
And
So why don't you go ahead?
I'm sorry, I was going to say, I don't know if you're due, but the plus points, so I was just excited to do
Yes,
this part as well. As
yes.
that
Please go ahead.
if I'm stepping on, I'm sorry. A husband, a father, a son, a Christian, exerciser, reader, gardener, rector, collector, especially of vinyl. Now we're reestablishing a CI, clinical instructor, and as I said before, a growing advocate for treating the lower limb loss community.
Well, they are all amazing PTA plus points. I am being a CI is near and dear to my heart because I do work in clinical education, and
Mhm.
so I find it. We need people as clinical instructors who enjoy teaching students and have compassion and who have patience and are willing to teach. It's just such an important piece of education. We literally cannot graduate students without it. So thank you for doing that. I appreciate it. All right. Well, let's go ahead and dive into some of the nuts and bolts of our conversation today. We're just going to kind of roll right into, it was a great segue, your career as a physical therapist assistant. But tell the audience, what is the value of a physical therapist assistant, and why do you see the physical therapist assistant as a core member of that rehab team?
Well, yes, that as a PTA, we're able to provide high quality care at a value, and being able to, especially with PT, but also where I am with an occupational therapist and a speech therapist, a lot of times it can be back to back to back. So it would be, I can present information that within that session to the OT or to the speech therapist instead of them having to chase down the physical therapist that evaluated them. And just being able to provide that and that opportunity, and kind of saying into, maybe we'll get into it later, but of now, especially I find the value of being able to slide a patient over if I have an opening from, say, my schedule, that maybe the therapist can do another evaluation or continue their care if a patient came in late, or if they want to continue to extend a certain treatment option or so.
Yeah, it definitely gives a lot of flexibility to that
Mm,
schedule, doesn't it?
yes.
Yeah. And I find that as a clinical educator, it's important for us to find the opportunities for our students to learn from other professions. So, not only intra-professional, but interprofessional
Mm,
training and participation. So, having access to that OT and speech, if it's available, or any other member of the healthcare team, we tend to think of just inside of our rehab team. But there's so many other people that have their hands or their words or their care within that patient's progression. So
Mm-hmm.
physicians, nurses, all of those things. And we need to learn about all of those professions as well. So to me, that's important that our students know that and have a good, clear understanding of what each person's role is on the rehab team and how important the PTA's role is on that rehab team. Because it's not just one of us. We all have to work together.
Definitely.
Yeah. Now you've made mention a couple times about uh, lifelong learning or CEUs or things that you like to do and learn about. So why are you such a big believer in lifelong learning? What does that do for you as a PTA? Why do you think that it's important? How has it shaped you?
Well, is that recently finding the value and it shaped me because I'm able to now, I find it more self autonomy from the being able to keep my skills sharp, but also being able to kind of provide to the other folks, especially like the PTs, maybe what I've known, because in the past where I was before, I kind of based it off of what other people had told me and I picked up tools in my toolbox. But now of having the to take it upon myself to apply that and that to be able to further benefit the patients of what I directly have learned through the courses or so. Because in the past, I had kind of just did the minimal for what was required for licensure aspects, but now is further, just to be able to be more of what can I provide to the patient and for myself benefit.
Yeah. Yeah, I'm not going to knock online education because I think that
No,
online
no.
education obviously has its place, but for me, it's that in person that
Mhm.
really gets me going. So like and that's just I know that's how I learn best, right? So like I said, I'm not knocking on online. Obviously, I'm a big fan of technology, but for me, I like to be in that room doing the thing, seeing the human being in front of me for different continuing education. I like to be able to get my hands on it. I've done a couple of like dynamic taping courses too. And to me, that was just like, I was just into it, like I could get my hands on things and get to moving. And that's what like gets me all fired up.
Yes, definitely.
Not that,
Yes.
not that there's anything wrong with just sitting and listening, but
But like you said, yes, there's great, much better benefit being able to hands on because that will help you to kind of reshape that into when you actually treat your patient that's with you.
Now you mentioned, and I say that you mentioned, and you and I obviously had a conversation before we started this, and also we've had communication back and forth. So sometimes the listeners like they didn't say that, but it's because we've already talked pre. But anyways, you mentioned some regrets about not taking different CEUs earlier or different advanced training earlier. Why would you say that? Why would do you think like it held you back, or do you think that um, there would have been a different outcome?
Yes, I think there could have been a different outcome, but honestly, the regrets I have because I did not feel adequate enough, especially as far as being as a clinical instructor. I didn't feel adequate of being maybe out of practice of 5 years or so in the career, and that if I had taken those more serious, then my career could have been a totally different trajectory where it is, which is fantastic now. But there's opportunities. I don't know if you remember the movie Space Jam, the '96 one with Michael Jordan,
I
but
remember
they had a great sound.
it.
Do what?
I remember it. I'm from the 1900s.
Oh yes, Nate Bargatze, yes. But they had a great soundtrack, and Coolio came actually to my mind yesterday. He had a song called "The Winner," and he sang it best when he says that when opportunity knocks, you better sit him on down and try to be his friend. And I did not do that in the past, and so now I'm doing that now. But it kind of what I see, yes, that people currently now kind of spurring me on to try to do new things, but I'm taking it myself. But in the past, one of those kind of regrets was that my wife and my parents, especially my wife, kind of championed for me to step into a possible new open position where I was before, and I did again not feel adequate. But looking back, yes, to regrets because I probably could have done that or learned as they can have leadership skills that can be provided to you or so. But yes, like hopefully the podcast name or I've thought about is yes to regrets. It's never too late to apply yourself currently. So, but yes, that's what I enjoy learning, even currently now more so.
That's a really great explanation of thinking about how things might have looked different or whatnot. Now, of course, I believe that you're obviously on the right path because you're where you are now and you're doing the things that you love to do now, right? So,
Yes.
regrets are a whole nother issue. But I like how I like the Coolio connection with the opportunity. And I always say, if someone comes to you and offers you some kind of opportunity, you don't have to say yes.
Mm.
You can say no, but you should at least explore it because obviously there's something that they see in you or that they feel is something that you're very good at that you could offer others. And I just never thought about that before in the past. And I would say that I also was, suffering from a huge amount of imposter syndrome.
Okay.
Like I'm still sitting here, like I'm not a podcaster. I don't have a background in podcasting or journalism or any of that stuff. I've had great mentors that have helped me along the way, but I still make a lot of mistakes and I still have a lot of bumps in the road and it's not always perfect. And sometimes I always say my guests are perfect, but I don't always make all of the right choices and whatnot in the podcast as well. But when someone brings you the opportunity, at least consider it,
Yes,
right? Give it a thought.
definitely. And it might lead to a close, similar opportunity.
Yeah. And so you have a certification in ASTYM, is that correct?
Yes.
Yeah. And how would you say that that has affected the way that you treat? Like, do you find that you've changed things? Like, do you have different theories now than you used to years ago
Oh,
because of some of this?
oh, yes. I definitely. I don't know if everybody knows what ASTYM is, but the augmented soft tissue massage and um, kind of to kind of speak about to the value of not of a PTA, but it was not just for PTAs, but for PTs that I was able to become certified at the time when we had a therapist that was going on maternity leave. And so I was able to become certified and apply that to her patients that so that they would not have that treatment option lost. And so we still
Mm.
continue to do that. But predominantly we do with the foot, like Achilles tendonitis or plantar fascia, but they have applied for many different body parts, and I've used that for the shoulder as well. But it's just kind of a crossover with being able to have that passion for treating the limb loss population, lower extremity, especially with finding a way to be able to help improve knee flexion contractures and potentially hip flexion contractures. And so I've found that to be valuable, and other therapists have kind of seen that. And also another kind of a benefit that led to an opening and foot in the door was talking with the owner or the founder of for the ASTYM and reaching out to say, could we use this for phantom limb pain, which is a very big uh, can be a very big issue for the limb loss population. So hoping
Mhm.
to be able to maybe do some research further on down with that.
Yeah, definitely. So what would you say to someone? Because you mentioned that you were able to continue treatment for a patient when someone was going on maternity leave because you were able to finish this specific type of certification. So there was
Yeah,
no lapse in what the patient needed and required, right? So
yeah.
what would you say to somebody who's afraid to advocate for themselves to get these types of advanced trainings? Like, what kind of encouragement would you give them so that they are more apt to ask for that kind of training?
Oh, that's a very good question. I've just, well, to be able to find out some of the information about that and do really good research and being able to come up with a plan to be able to talk to the person that might be able to provide that opportunity to take that certification because you know how it can benefit certain folks. And I understand that it can be nerving, to try to talk to someone and
Mhm.
advocate for yourself. But the more that you know will help you out and kind of a phrase or so that I've tried to think about is if I find this, I can't really think about mumble it up, but I find value in this, and this might be valuable to the patients that we're treating or so. And so if you can
Mhm.
present that shows that you've taken the time investment in research and being able to apply yourself to that would become more of an opportunity to be set for you.
Yeah. Yeah. A friend of mine always says, well, you know how there's the saying that what's the worst that can happen? Right.
Yes.
But he spins it and he says, well, what's the best that can happen?
Oh,
So
yes.
if you don't ask, it's going to be an automatic no. But if you
Correct.
ask and the best thing happens and they say, yeah, sure, we'll pay for it or we'll support you to go, then that's kind of a win-win for you and your patient. Right.
Definitely.
Yeah. Now you're also, because you're just like, you're just crushing it here as a PTA. You're also going through the evidence in motion orthopedic specialty certification, or is it the
Yes,
certification
correct.
in orthopedic specialty? I
It's a
always get it
mouthful.
backwards. I'm so sorry, evidence in motion. Please forgive me. I will get it right one of these days.
As I will, yes. But yes, that's been exciting. I had an opportunity to kind of get my feet wet with that because it's like a 9-month process, but I was able to complete a section of it with the virtual skills lab, which was spread out for kind of like 2 months, but you would do watching the lectures on the videos, but then to have weekly, which I found fascinating, was being able to be kind of like on a Zoom call with other PTAs. And so all across the country. And like I said before, of not being very many interactions on the video thing or so, but having folks that were more so just graduated younger than I, a few that were the same age, and then I think there was a gentleman that was a couple years older or so. But to have that setting was awesome. But to be able to practice that. Now, what you said about being with in person, even though what I am taking is strictly online, like virtual, I used as well as with the ASTYM to practice with my wife on doing these techniques to be able to present on a video
Hmm.
that the course director have to watch and to critique and make comments on. And it's also as well as to be able to do that with my children and they'd be like, oh, look what he's doing. So maybe that will spur them to try to do something else as well and find out how it would be when there was a ticklish patient or so.
Yeah. So it's
Um,
still, yeah, it might be virtual, but you're still doing hands-on. You just
yes.
had to demonstrate it through a video, right? Yeah.
Yes.
Yeah.
And then plan on picking that back up in July, and we'll finish in March of next year. And just um, great, especially if you're starting in your career and you have no kind of things to hold you down, obligations or so. It's fantastic to try to do, but it's a little bit of a challenge, which has been fun if you have a full workload or doing something else, pursuing other things, to be able to find a niche out time for that. That's been exciting to be able to do. So it's just all about growing and learning.
All right. So we're going to move on to the next question. Sorry about that. Technological issues here
Uh,
in Ohio. So please forgive me. So we're going to move on to the next topic, which is the reason why you and I really connected because of your amazing article in here. You have now found a passion with working with people who have limb loss. So tell me a little bit about how you've decided to kind of advocate for this population and pursue more seriously now than maybe what you did in the past.
oh, yes. Well, where I am currently, I treat about 3 to 5 a week, the extremely limb loss. And where I was before was maybe 5 within a 14-year time span.
Mm,
And as I think we mentioned before, or no, but remembering from PTA school, I don't know if you remember, Katie, of what to do with amputees. I basically just remember wrapping the residual limb to try to reduce the swelling and being able to try to mitigate hip flexion so that they can stand up taller and all that. So during those 14-year times, it was, maybe 5 or 6 times that I actually worked with them and didn't think of anything. But now it's almost every day, and just the nuances have just blown me away. And that basically there's just, you think about it, there's an above the knee and a below the knee amputation, but you have, especially more challenging, is an above the knee, which they have there. I can have a microprocessor, which is a computer, which I don't remember talking about much in PTA school. So that aspect is just like, okay, this is exciting. But really, a big thing is where I work is with medical and health and resources. is a prosthetic and orthotics company in the same facility. So being able to team up with them has been very exciting.
Yeah, tell us a little bit about that because you've been able to kind of get connected to several different groups and several different professionals in your area. So, what was that like? Like, was this like you reaching out to them, or how did that kind of get started?
Well, it kind of started off with I hope to get into it more as a nationwide thing called So Everybody Can Move, and they just passed it in Georgia, something to make it more easier for patients that might have a second prosthetic leg for recreational things, which I can't believe that it's, you have to fight tooth and nail with insurance to get that. But I just kind of researched myself as a company called Amputee Coalition. It's a great resource for the limb loss population and being able to connect on the forum, which is like a blog, and reaching out to find other PTAs predominantly that might have the same passion. But that linked me into closer to in Peachtree City. There is a therapist that I believe is kind of more specialized with amputation. So I'm hoping to connect with her coming up maybe in the summertime or next year after I've done with the EIM course.
Yeah, that would be great. Now, was there like a because you made mention that in PTA school we just simply don't have the depth and breadth that you are getting now with your patients that you work with every day. I mean, it is somewhat abbreviated, and maybe there are a lot more skills that are beyond entry level once you get out there. But was
Mm.
there like a specific moment that you were like, "Oh wow, I don't know near as much as I thought I did, and I need to get more information and I need to get more resources." Was there like a moment that you were like a light bulb moment?
Oh yes, definitely. It was honestly probably it was my first patient that I saw by myself. I was reading the evaluation, and there was I can't remember what side, but it had a prosthesis, and I come in there and have them into the parallel bars, and oh wow, okay, I've seen this before, but what do we do? And it's not fitting quite well. Well, oh, there's a bag of socks. We can use socks to make it bigger or smaller. I didn't really remember any of that, so I was just finding um, the uniqueness of that. And honestly, yes, I forgot to mention that I find it as a niche as HPRC where we work. There's about 5 or 6 clinics associated, but we are the predominant one other than the VA system that treats the extremity population. So I said, I got to plug myself into this. And so it just going into a rabbit hole, deep dive that's just everywhere.
Yeah. Yeah, it's it is pretty interesting whenever you get yourself into a situation. I mean, we're like chameleons as
Mhm.
PTAs, right?
Yes.
So and especially in your I mean, I think it happens in all settings to some extent, but I feel like when I was working in outpatient, specifically in a rural area, you just never knew what you were going to get. Like you could potentially have an amputation, lower or a limb loss patient, but you also might have a 3 month old baby with torticollis. Like it was
Mhm.
just all over the place because we were rural and we wanted to try to provide things for people so that they didn't have to go very far. So I found myself very often having to like research and kind of dive into the material and find people who had some knowledge that I could kind of learn from and get mentorship from. But yeah, it's a pretty eye-opening experience when you're like, oh, I've never seen that, or I learned about that a long time ago.
Yes.
So, what would you say to somebody who's thinking about taking a job or kind of creating their own kind of niche type practice? And maybe that isn't necessarily starting it themselves, but now that you have kind of developed this interest and love towards assisting people with limb loss, you're drilling down, you're learning more information, you're trying to gain some of that knowledge. But what would you say to somebody if they're like, I'm thinking about going into I'm going to throw out something there like pediatrics or HIPAA therapy or something like that, where it's like very, very unique.
Yes. I would just say just go for it. If it's something that's pulling at at your heart, and it makes you excited and just want to, of course, go more so when you see that certain population to just dive into it and to not be afraid, because you might not know everything that there is, and probably honestly you would not know everything, but you can come alongside the people, and people will find you, as I'm finding that. But it's really kind of a lot of up to you, and I know that can be, nervous to do, but very exciting once you start to take those first few steps to just go for it, because you want to, and then that's all you have to do, and take that step and it will be there.
Yeah, you have to you sometimes have to take it upon yourself to
Mhm.
push yourself a little bit further because I was just talking to a colleague this morning. There's nobody who's coming to save you. So you and you alone are responsible for your professional growth.
Yeah.
Nobody's going to throw you a buoy and say, here you go, come on in, here's some free education. I mean, they might give you free education, but I mean, like, you still have to be the one participating in it, right? Nobody's
Yes,
going to rescue your career. You've got to
that's right.
build it yourself.
Yes,
You got to create a plan.
that's right.
hmm And it's okay if we don't know the plan right away. I think, especially as a young professionals that are coming out right now, this is graduation season. It's okay for them to just explore for a while, take a few years, get into a couple different settings, see what you like, and
Yeah.
then start to drill down, make yourself valuable.
Or take yourself 14 so years before you decide to find
That
out what it is.
too, that too. But I'm willing to bet that you probably were more knowledgeable in certain areas than what
Mm.
you're letting on to everyone. But
It might take a while. I'm just saying it might take a while to find where in your niches, and don't be afraid as soon as it is there to plug in, because it can lead to wonderful things.
yeah, agreed. So April was Limb Loss Awareness Month, right?
Yes.
Yeah. So is there things that happen that other PTs or PTAs could plug into to kind of help with this awareness, or is there any like campaigns that go on, any kind of events or activities?
Oh, definitely. Like I mentioned before, with the Amputee Coalition, you can just go onto their website and they have the forum. You can kind of reach out to other people, but they also have the resource thing where you can, as I did with kind of spreading on social media, just April, they have a kind of a set template that you can use and have challenges, and um, which I found awesome, being able to that I just like to do things that recently set up with a former patient and the great team at Medical Health and Resources and HPRC as well, to set up a awareness kind of night at a local major minor league baseball team, the Columbus Clingstones, which are Atlanta Braves affiliate. So we were able to have a table set up with information, and as I mentioned before, of a kind of a big reader, I found books of folks that have limb difference and limb loss that are big inspirations. So had that for attendees to walk by and see, and then was it was amazing to be able to have the the team to be able to put limb loss and limb difference month on their video board, and there was about 4,000 attendants there, so that was
Wow.
amazing. And they said that they were going to continue it for the rest of April and hoping to expand that into next year.
That's pretty amazing. Talk about awareness, right?
Yes,
So
but
tell me a little bit about, oh, go ahead. Do you
no,
have
you
more
can. You
to
can.
add? I'm really interested in how, because if nobody is familiar with the article that we're talking about,
Mhm.
or if they don't get APTA's article, this is it was in the March 2025 is when
Yes,
it was released. And so you can see here we have John and one of his is this one of your clients that
yes,
yeah,
that,
uh-huh.
that gentleman was awesome.
And I think you even made mention about him in the article, which is really really fun that you were
Oh,
able to talk about this experience. But so what is this like to be able to submit to APTA? I mean, is this something that you would encourage other people to do?
Oh, definitely. As look, and I think it was just email to APTA. to whomever it may concern, and that you're interested in doing an article, which I found was great with the defining moment, because that can help propel your passion even further, and it led to being able to speak with you and to many other things. But basically just explaining what maybe your passion was, what led you to that. As I've said before, it was just not knowing something and then being in the mix of it, and just basically saying what you love about it and what led you to it and how you can continue to pursue it. And as I understand in doing research of it, that magazines or in article editors are basically looking kind of for material instead of them having to necessarily search out for it. So I found that very valuable. So it's more than likely that they will pick up on it.
Yeah, that's a really good point. I think that APTA in particular, I know loves having the PTA voice.
Mm,
I think that there's sometimes a misconception that PTAs aren't often heard, but I think if anything, they would welcome more PTA voices out there. And so I think that it's great that you were able to submit this. It's a great story. I think it's perfect for the defining moment. I think that it really drills down into who we are as physical therapist assistants. And I think it also broadens and shows how many different things that we can do.
mm,
We're not, stuck in one particular area or one particular setting. We are very much so interested in the human experience, and that's really what this leans towards. It's I mean, you do really great work, and you get to work with amazing people, but you improved their experience
mm.
by the treatment and the work that you were able to do with them.
Oh, thank you.
Great. I have one more question. Actually, two. I have two more.
Uh-oh.
But this one I think is pretty special. So you have a very unique party skill set. I don't know that I told you I was going to ask you this, but
Uh-oh.
so the worm and juggling ginger snaps, is that correct?
Juggling snaps.
Juggling snaps. Okay,
Yeah.
so I'm sorry, I got it wrong.
No, you get. I don't know if I can. I don't know if I can demonstrate the worm now, but
Okay, all right. Well, it's okay. You're forgiven. We won't make you turn the camera to show us the worm or anything like that. But just knowing that this is your very specific, unique wedding party skill set that you have. Obviously, you're a fun guy. So how do you see this transfer over this fun, the fun part of John? How does that transfer over to your patient care?
well, yeah, I could demonstrate. I can demonstrate the juggling snaps, but I have not. I need to come Monday. I will have to demonstrate the juggling snaps. If
Okay,
basically, and then you can just however long you want it to come, and then back and forth.
gotcha. Okay.
So I was doing that at a wedding, and somebody just said, "Oh, wow, that looks like you're juggling some snaps," and I was just doing motions, and I said, "I'm run with it." So, but definitely uh, that is who I am in the clinic, and like I've said before, of being with HPRC, kind of feeling like as a family, that I came into a group of people that have been working together for 10 plus years, and being with a newbie, a little bit nervous. I'm very extroverted, but once I get settled into the position, then I'm able to come out of my shell. But that goes towards being able to brighten patients' days, as I feel, is just from a random dance or a song or silliness, because you never know that you might be the only smile that that patient might see during that day.
Something that we need to keep in mind. A friend of mine, Sean, I've made a shout out to Sean twice today, but he always says that treating patients is a privilege.
Hmm.
And I don't think that we think of that often enough, but treating patients is a privilege. And then from my flip side, as somebody who works in PTA education, teaching students is a privilege. It's an absolute privilege that I get to be a part of their life. So I think that we should maybe keep that in the front of our mind more often, and that might change the way that we interact with other people.
Oh, yes.
Yeah. So this really is my last question, and it doesn't have anything to do with your party skills. I don't think, anyways. But so if you were speaking to another PTA who is kind of feeling stuck or they don't really know what to do next, even if they've been in the career for 14 years, or 20 years for some of us. What would you say to them in redefining their purpose and finding their passion?
That it's never too late in your career to pursue your passions and further educate yourself and others.
I like it. That's a great way to wrap this up. And I mean, it ties in perfectly to what we like to talk about here on this show. And that's just highlighting all of the unique things that we can do and that we get to do as we have the privilege to treat patients and teach students in this great field of physical therapy. So I do appreciate your time. Thank you so much for coming on and sharing your experience and sharing your experience with your article that you wrote for APTA. Congratulations. It's wonderful. Everybody should go and read it. And then, John, is there a way that you can get me in some of the information for some of the limb loss partners that you work with so that we can put that in the show notes?
Yes, I think it's like an amputee. I think it's just amputee. I don't have it written down, amputeecoalition.com. And so everybody can move there. I know there is one in Georgia. Kind of just basically those two actually now. Again, I've kind of found it's to be one is OP Edge is a magazine, and Amplitude, which is another one for a magazine.
Cool. Well, that would be some great resources for our listeners. So we'll make sure all of that is embedded into the show notes. But with that, John, thank you so much for your time. I appreciate you coming on.
Well, thank you, Katie. I enjoyed it.
Great.
Thanks for listening to PTA Plus, the podcast for PTAs by PTAs. Subscribe, follow us on social, and share the show. Elevate yourself. This show is for educational purposes only. No clinical decision-making should be made from its content. See you next time.